Today's December 8th, 2015. We're here with Delilah, who comes to us with knee pain. She's interested in ozone therapies, and she's got some neck issues too. I've done nothing with her neck yet except take a history. And I'd like to see you get up off of the chair, walk to the door, and come back, please. And come back. And then you can please sit down. Very good. Pretty smooth motion. Okay, and you've got some neck issues, so let me see you turn your head to the right, please, as far as you can, and to the left, please, as far as you can. A little bit better to the left, and now we're going to turn you this way. Look straight ahead. Bend your head back as far as you can, and now bend it down as far as you can. Excellent. Thank you very much. And I have your permission to video you and post you on YouTube.
Yes.
Thank you very much. Okay, Delilah, we just got done your knees and your neck. We're not going to deal with your knees because they weren't so much of a problem right now, but your neck was bothering you a little bit. And let's see you turn your head to the right, please. And now to the left. Wow. What do you think of the movement to the left?
Better.
You're pleased.
Uh-huh.
You can notice that immediately, right?
Okay. I'm
Okay.
surprised that you can notice it so soon.
Good. Oh. And bend your head back as far as you can, and bend it down now. Touch your chin to your chest. Good. Okay. What we're seeing in your case is you've probably got about 5 degrees more rotation to the left side. I'm really happy with that, and you're happy too. And yes, it can happen immediately. More often than not, it does. And usually it holds. And as far as your knees goes, well, you weren't in that bad shape today. The idea, you do have mild degeneration in your knees. I can tell that on exam. And if you decide you want to get ozone on an intermittent basis, I think that would be just fine for them. Okay?
So will it keep improving, or that will stay like this now?
That is an excellent question. I've had patients where it keeps improving, even over the next couple weeks. I've had patients who did better for a short time, and the next morning, some of the loss of motion was back. And then with more treatments, they do better. Generally, 80% of my neck patients do significantly better. So it's hard to say on an individual basis, but you're having a very, very typical response. And when I see an improvement like that immediately, what it tells me is I got the injection in the right location. That's my job. That's what you pay me for. And then the healing is up to God and your body. But my job is to get the treatment in the right spot. That makes sense?
Yeah. And with the neck, I was feeling some tightness with the neck all the time. It was there all the time.
And now?
Now it's not.
Okay.
It's loosened up.
Yeah. And that's
It's like free.
right. That's what I like to see. And actually it's what I expect. I get my neck done too. My wife does me. Okay. Thank you very much.
Thank you.
You were saying?
Oh, I was saying that I'm amazed that it can work immediately, right away. I thought maybe it would improve over a little bit of time, but right away.
It was shocking to me too. Yes, it can work right away. Now, in truth, there's a local anesthetic in there, and that reduces some of the pain. But a lot of the patients, the pain doesn't come back, and in a lot of the patients, it actually gets better over time. That's because the ozone steps in right away, if it's in the right location, to reduce the inflammation. It's inflammation that causes the pain. And the ozone modulates inflammation and cuts it down as soon as it's administered. To me, it's the best treatment there is in the world.
So does the ozone stay in the body?
The ozone is gone very quickly. It converts to oxygen, but it leaves some molecules behind that stimulate healing. So the oxygen that's there, and that I just put in your knee, you can feel some gas in your knee. You heard the squishing in your
Yes.
knee.
Uh-huh.
And that will be gone by tonight. The oxygen will be absorbed, but the effects of the ozone will last. I can't tell you how long. You might need to do it again. You might not need to do it again for a long time. I told you I get it done on my neck periodically, and I do it when I need it.
Does it stimulate healing
Yes.
inside the body?
Yes, that's what it's doing. Ozone seems to, we have some good reports that ozone stimulates cartilage regrowth. And Italians have done, and Cubans have done research showing that it improves discs in the back and it reduces disc bulging.
Does it help meniscus? Because I think I was told that I have a meniscus problem.
Well, let's use myself as the example. About 5 years ago, I had a clunking in my knee. It was really bad clunking. And one day, under full load on a bicycle, a mountain bike, going up a hill, I felt an earth-shaking clunk, and I thought I was going to shatter my joint. I went to a doctor, and I had an MRI done, and it showed a degenerating medial meniscus in my left knee. And I went to an orthopedic surgeon, and he said to me, there's nothing I can do. He said, I can take it out, but your risk of arthritis is the same if I don't do anything. I said, thank you for your honesty. I paid his bill, left, and then I went and I had several things done, including ozone. Within a year, I hiked the John Muir Trail. You know what that is. It's the longest, toughest, highest altitude trek in the lower 48.
Oh, yeah. I've heard.
200 miles, average elevation, 10,000 feet. Now, that was from a knee that I couldn't, it was clunking walking across the hall, across the room. You would have heard it. It was that bad.
Wow.
Right. That was me.
So it regenerated?
I believe so. Either it regenerated or it just healed it. It calmed it down to the point where it's a nothing for me. Nothing at all. I don't even know. I knew I had a knee. If I walked, it clunked. I don't notice anything now.
It's very impressive.
Yeah.
Yeah.
Thanks.